Dr. Schuler, what are your thoughts about artificial discs in general?
Well, that's probably one of the most exciting topics out there is disc replacement, which is really motion preservation. How do we heal somebody who hasn't been able to get well non-operatively and get them back to their life optimally? And it's how do we preserve motion? And that's what a disc replacement is. When you look at the spine, each level of the spine is comprised of 3 joints, a disc in the front and 2 little facet joints in the back. The facet joints in the back allow your spine to move and bend as it functions. When you do a disc replacement, you replace the disc in the front, but the 2 joints in the back are left alone. So for a person to get a disc replacement, they need to have those 2 healthy joints in the back. But the benefit of disc replacement in the neck and in the low back is that we're preserving motion and we're not putting stress on the adjacent level. So when it's possible, a disc replacement is a better option. Now, we have to understand it's not always possible because as we talked about those 2 joints in the back, if they're arthritic or broken down, then a person may not be a candidate for a disc replacement. Or if there's a structural instability where the spine's sliding too much, then that is something which may require a fusion to stabilize. But when we do disc replacements, we're seeing people get so much better. And I've done 4-level disc replacements, 3-level disc replacements, 2, 1, etc., throughout the spine, in the neck and the low back, and we can get the people back to their function. We also combine disc replacements with fusion, where we may put a disc replacement at 1, 2, or 3 levels and do a fusion at the most unstable or the most degenerative level. And so doing that really helps. I think the important thing is for people to understand in the future, people aren't going to be saying, should I have a disc replacement? It's going to be, why am I having a fusion? So if a disc replacement is possible, it's a superior treatment today. And we've been doing this since 2005, and we've seen incredible change and evolution of the implants. And what we have today, we're 7 generations later, and they're truly remarkable, and we're seeing phenomenal results. So disc replacement is something that is exciting. It's the future. It's the present.
And also to add, you believe in the technology because you have a few in your neck.
I do. I have 2 disc replacements in my neck. I also have 2 fusions. So sometimes it has to be combined. In my case, it was combined, a fusion and a disc replacement because that was the best treatment. But absolutely, I forget. It works so well, I forget I have it. So it's one of those things that having a disc replacement is something that I do, but I also believe in, and I've had it done to me. So it is the future.